All right, so today we're diving into something pretty crucial, folks. The state of healthcare in Nigeria.
Yeah, definitely a big one.
We're basing this deep dive on an episode of the Money Matters podcast, the one where Clement and Faith really dig into, well, all the complexities of it.
Yeah, they had some pretty eye-opening points in there.
For sure.
I mean, think about this for a second. Only 4% of the government budget goes towards healthcare.
4%.
Yeah, 4%.
That's unbelievable.
Right. And they even shared the story. It was about our rural clinic that was just, desperately short on just basic supplies.
Wow.
Like, can you imagine trying to run a medical facility without things like bandages or antibiotics?
It's almost impossible to even fathom.
Yeah.
And that lack of funding, that really seems to be the root of so many of the problems that they talked about.
Oh, absolutely.
Faith, she kind of described the whole situation as a mixed bag, where you have these pockets of really excellent care, particularly in the private hospitals. But then the public system is just struggling to keep up.
Yeah.
To actually meet the needs of, well, the vast majority of the population.
Yeah. And that limited funding, it really does impact every single part of the public system.
In what way?
Well, think about it. It makes it really hard to attract and keep skilled healthcare professionals. It's hard to maintain the infrastructure, the buildings, the equipment.
Right.
And then even ensuring a steady supply of essential medications becomes a challenge when you just don't have the resources.
So you end up with this huge disparity in the quality of care that people can access.
Exactly.
And it sounds like it's especially tough for people in rural areas.
Oh, yeah, definitely. They often face, the biggest obstacles when it comes to getting healthcare.
I remember Clement in the podcast, he mentioned this woman who had to travel for like 2 days just to reach a hospital that could treat her child.
2 days.
2 days.
It's just heartbreaking.
It is. It's heartbreaking. And it's just mind-boggling, to think about. It makes you realize the real human cost of these access issues.
It goes way beyond just individual health, too. It affects the whole community.
How so?
Well, think about the lost productivity when people can't work.
Sure.
The strain on families, having to care for sick loved ones, and then the potential for preventable health issues to become something much more serious.
Right. So it's like this domino effect that touches every part of life.
Exactly.
And then on top of all of that, they talked about disease outbreaks, having to deal with things like COVID-19, Lassa fever, and monkeypox.
Yeah, and it's concerning because while there were obviously efforts made to respond to these outbreaks, Clement and Faith both pointed out some serious gaps in the system.
Like what kind of gaps?
Well, they talked about inadequate preparedness, so not being ready for these kinds of events.
Right.
Breakdowns in communication between, different levels of government. And then, of course, the constant problem of insufficient funding. It just keeps coming up.
It's a recurring theme, for sure. But there was one positive thing they pointed out.
Oh, yeah.
It was about the role of private healthcare providers, how they stepped up to support the government's response during these outbreaks.
That's a really good point. It shows that there's a lot of potential for collaboration between the public and private sectors.
Yeah. What if they could work together more effectively? Share resources, coordinate their strategies, and really build on each other's strengths.
Imagine the difference it could make, not just in responding to emergencies, but also in providing more well-rounded healthcare overall.
Okay, so let's talk about some potential solutions. I know they spent quite a bit of time discussing the National Health Insurance Scheme, the NHIS.
Right, the NHIS. And the idea behind it is great. It's meant to protect people financially from, the huge cost of getting sick.
Makes sense.
But while it could make healthcare much more accessible and affordable, Clement and Faith were pretty clear that there are some big roadblocks in the way. Well, for one, the rollout has been much slower than planned. And even now, coverage is still pretty limited, especially for people working in the informal sector.
Which is a big chunk of the population.
Exactly.
So good concept, but the reality is a little more complicated.
Yeah, you could say that.
One thing I really appreciated was that Faith wrapped up the episode by offering some solid recommendations for moving forward.
Yeah, she didn't just point out the problem, she actually gave some solutions.
She did. She said something like, we need to prioritize healthcare funding, we have to improve access to quality care, and we've got to foster stronger collaboration between the public and private sectors.
Straightforward, but so important.
It's a call to action for everyone, for policymakers, for healthcare professionals, and for everyday people.
To demand better.
Exactly.
And it leaves us all with a pretty big question. If you were the one in charge of redesigning Nigeria's healthcare system, what would you focus on? How would you tackle these issues and create a system that works for everyone? It's a tough challenge, but it's one that we need to keep thinking about.
Absolutely food for thought for all of us. And on that note, that's a wrap for today's deep dive.
Thanks for listening, everyone.
Catch you next time.